thing to remember too is that osteoporosis and bone density, I could go on for hours. There's books and books and books written on the information. And so consider this just a primer. We're just getting our feet wet. It's a complex subject with many moving parts. Some of the things I want to address are some of the questions that come up pretty routinely within the clinic from a clinical standpoint, as well as from a membership standpoint of people asking Elizabeth and I questions. The first thing that comes up is, should I or should I not get a Dexa scan? I'm going to give you an example of Elizabeth. So Elizabeth is 54. If you look at the literature, they say that you don't really need a Dexa scan until you're about 60 or 65 for females. And men, I don't think they recommend it until you're about 70. So Elizabeth called and asked the nurse if she could have, schedule an appointment for a Dexa. We needed a referral from the doctor. Well, the doctor had said that, oh, actually, you're 54, you're too young, don't worry about getting the Dexa. Had Elizabeth left it there, then she would have said, okay, doctor said not to worry about it until I'm 60. However, the thing to remember is that physicians are busy people. I have a great physician, Elizabeth has a great physician, but they have hundreds upon hundreds of clients. So it really is up to us to be kind of in charge of our health, the CEO of our health. And so the thing to remember that Elizabeth luckily knew and asked the nurse is that if you are in a high risk factor category, if you are 50 and older in a high risk category, then the Dexa is more than likely appropriate and the insurance will cover it if you're high risk. Now, what are some of the areas that make you high risk? Number one, if you have an autoimmune condition. And Elizabeth has been taking Synthroid for a low thyroid, for hypothyroidism for, oh my gosh, 30 years maybe, something like that. And so if you're on autoimmune, or if you have an autoimmune condition, if you're on any type of long-term corticosteroids, so prednisone or any long-acting anti-inflammatories, that can also affect bone remodeling. Alcohol, sorry to harp on everyone about alcohol, but the literature says if you drink more than 2 drinks a day, then that puts you at a risk for bone loss. Diet, if you have, if you are high in sugar, if you have diabetes type 2, if you are close to being diabetic, that is a risk factor. If you have a mom or an aunt that is osteoporotic, that is a risk factor. So there's a lot of risk factors that go into it. And the thing to remember is that if you fall under that risk category, then that is a discussion that you need to have. So Elizabeth talked to the nurse and said, well, actually, I've got autoimmune condition. And also, too, if you have any type of gut issues, malabsorption, you might be getting all the nutrients, but if you're not getting it absorbed in the way in which it's supposed to be absorbed and the chemical breakdown that's occurring in the stomach is not happening, then that also can put you at risk. And so once Elizabeth was explaining some of these things, Elizabeth has some GI stuff that she's working out, that she's been food sensitivities that she's been working with for a long time, plus the autoimmune put her in the high risk category. So then all of a sudden the nurse was like, oh yeah, of course, now you will, and now we'll write the referral, and Kaiser has said they'll cover it. So it's really important to understand that. So if you are in a high risk category, please talk to your doc about getting a Dexa. A Dexa basically is it's like an x-ray. And what they'll do is they'll measure the density of the bone, usually in 2 places, the lumbar spine and the hip. And sometimes they do the wrist. And then what they do is they give you a score. It's called a T-score. And they compare it to someone, an average 30-year-old female. Because why do they pick 30? Is because at 30, we are close to having our peak bone mass density. So what they say about osteoporosis is that it's a pediatric condition with a geriatric manifestation. So what I mean by that is that when we are younger, up to about the age of 30, excuse me, we really have to work hard on building bone into our bone bank. Because then what's going to happen is once we hit about 30, it's really hard to make any more deposits in the bone bank, and then we need to live off of that for the rest of our lives. So like my daughter Hope is 17, and I'm always getting on her to be as active as she can, running, jumping, high impact sports, weight training. Those are all things that are really important to do because she's not thinking about osteoporosis at 17, but we are, because we know that she needs to build strong bones now, and then her 50, 60, 70, 80 plus year old self will be thankful that she did that way back in the day. And so you get an idea of the T-score. If your T-score is -1 or higher, it's within the normal range. If you are -2 to -1, they consider that osteopenia, or a precursor, which means the bones are softening, but they're not quite full on osteoporosis. If your T-score is less than 2.5, then you are kind of considered into the osteoporotic range. And so if you're -3, -4, then you're in the osteoporotic range. The question then becomes, should you take medications or not? And that's a discussion to have with your physician and to look at all the angles. The thing that I'd recommend first, and this is what I tell all my clients, because there's so much that goes into building bone density, I would make sure that I'm doing everything that I can first on my own before I resort to the medication. And the reason is because there are side effects, some serious side effects of all of these osteoporotic medications. Now, I'm not anti-medicine whatsoever. I just like to lay all my chips out on the table so I know what's going on. So for example, I know that high impact activity will help bone density. So if I'm not really exercising, if I'm not really doing much weight training, maybe that's contributing more to the bone loss. Maybe if I've got some gut irritation and I'm taking a lot of antacids because I've got an upset stomach most of the time when I eat. What people don't realize about that is you could be taking your calcium supplements, you could be getting your green leafy vegetables and try to eat as much calcium as you can. But if you have an acid issue with your stomach needs acid to be able to break down that calcium into micronutrients that it can then absorb. So it's really important that if you are one that takes Tums on a regular basis, you have to ask yourself, why are you needing that? Is there something going on in your diet or your lifestyle that's requiring you to need that? So you may have to change the way in which you eat, because that Tums that you're taking, or that Nexium, or that Prilosec that you're taking, could be affecting your bone density, and you don't even know the two are related. So it's really important to kind of get your house in order before taking any medications. One of the side effects of medications, and let's back up a little bit. The first line medicine, the way it works is this. We have, within the bone, we have osteocytes, which detect the amount of compression within the bone. We have osteoclasts, and the clasts are the ones that kind of, we're constantly remodeling bones. So the clasts are the ones that kind of break down old bone and then make way for the new bone, which is built by the osteoblasts. So osteoblasts build up the bone, osteoclasts break down the bone. What happens in an osteoporotic situation, and this happens, by the way, throughout life, what happens in an osteoporotic situation is that the osteoclasts break down more bone than the osteoblasts can build up. And then the net result is a loss of bone. So with medication, like Fosamax, for example, or these biphosphonates, what they do is they limit the action of the osteoclast. So if the osteoclasts aren't breaking down as much bone, but the osteoblasts are building more bone, I can see why then our net result is greater bone. However, remember what the osteoclasts do. They kind of break down the microfractured bones, the brittle bones, so they're kind of getting rid of the old ones to make room for the new ones. But if the action of the cleaner uppers is limited, so yes, we have more bone, but the quality of bone isn't great, because what we're doing is we're holding on to old, damaged, brittle bone. So it's not a great trade-off. The other thing that can happen, which I'm sure if you've researched it, you hear about these stories about it, is osteonecrosis of the jaw, which basically means your jawbone starts to die. So then if you happen to be getting some dental work done, oftentimes dentists won't even work on you if you've had, or they'll make you sign a bunch of releases, because it is pretty dangerous, because you can actually have the mandible here, the jawbone, kind of wasting away a little bit because of the way the interaction is with the biphosphonate drugs. You can also have an atypical hip fracture. It's not been uncommon for the hip to actually fracture. And there's a whole host of other adverse effects. Now, some of these adverse effects are pretty rare, but still, if it were me or if it were Elizabeth, we would both look at everything that we can control first. So you have to look at it from a supplement standpoint, right? Doctors talk about calcium and vitamin D, but there are a whole host of other micronutrients that we need in order, imagine, tilling up the soil in order for this bone to grow. So it's really important that you get dialed in. Now, how much calcium do you need? The recommended dose is about 1,200 milligrams. How much are you getting? Most people will say, you know what? I don't know. So I just take a supplement. Well, you have to be careful that you're not getting too much calcium. Calcium carbonate breaks down differently than calcium citronate. Calcium citronate breaks down a little bit better and is more usable by the body than calcium carbonate. So one thing that I recommend to my clients is get an idea of a food log for 3 days and 3 typical days of what you eat. If you tend to eat a salad with dinner, or usually have some sort of vegetable, maybe it's a broccoli or zucchini or something, but get an idea of what you eat for 3 average days and figure out how much calcium you're getting. It's pretty easy. Just got to, it's a little bit of a hassle, but you got to measure out the food that you're eating and then figure out how much calcium you're getting. So ideally, you're getting close to your 1,200 milligrams from your diet. Then if, let's say you're only getting 600 milligrams, and then you would supplement. But I really don't recommend just arbitrarily supplementing, because if you get too much calcium, it can actually be detrimental to your health. So really want to be in that right range. Same thing with the vitamin D. You may have to get a baseline. Recommendations are anywhere from 800 IUs to 2,000 IUs, but it depends upon where you're at. So that's definitely a discussion to have with your healthcare practitioner or your doctor to make sure that your vitamin D and your calcium are in line. And then there's other micronutrients that we'll talk about, but those two work together. So you might be taking your calcium, but you really need the vitamin D to help absorb the calcium. And so it's really on us to take a look. And if you haven't been to the doc, if you haven't had blood drawn in a few years, maybe it's a good idea to kind of get a baseline to see where you're at. With the Dexa score, we get more information from the second Dexa score than the first one. And let me explain that to you. So Elizabeth's going to get her first one in, and she's 54, so I'd imagine that she's going to be at least minus T1, somewhere in there, because she's starting to show some loss because she hit her peak bone mass density almost 25 years ago. But let's say she's minus 5%. But we don't know. She may have been minus 5% for the last 10 years, or she may have been minus 5% for the last year and a half. Until she has her second Dexa, right? The first one just gives you a snapshot of exactly where things are at right now. But what we don't know is how much regression we're getting. In a normal situation, we should be losing no more than about 1 to 1.5% of our bone mass density per year. So if someone is losing 2%, 3%, 4%, 5%, then those are red flags that go up. So based upon what her Dexa scores are this year, they may say, you know what, let's recheck in a year, or let's recheck in 2 years. Then it's on that recheck is really when we get even more information, because then we're going to know how much she actually maybe gained, lost, or stayed the same, and then we know the interventions that we're going to have to take. Next question I get is, well, I'm not playing a lot of sports anymore. Basically what I do is, I do some walking. Is walking enough to build bone density? Unfortunately, walking is not enough to build bone density. And I'm going to give you a physiological reason why. There's something called osteogenic loading. And basically what that means is, in response to a certain amount of stress, the body comes back stronger. So for example, when we're strength training, right, you hear about 3 sets of 10. And the reason is because that's about the volume it takes. Those last few reps should be a little difficult to get. The reason is because we are stressing the muscle to a point where, okay, now we're going to rest, let it recover, comes back a little bit stronger. Then in another couple of days, we stress the muscle again. And that's how we build more muscle mass and strength. Same thing with the bone. We have these osteocytes within the bone, and they detect pressure on the bone. So imagine if I am doing a lot of walking, a lot of weight-bearing exercises, those osteoclasts are stimulated. So in order to really truly build bone to its maximum level, we sometimes need to have 3 to 4 times our body weight. And just for the sake of simple math, let's say I weigh 100 pounds, because I'm not great at math. Let's say I weigh 100 pounds. That would mean that I would have to like squat 300 to 400 pounds or bench press 300 to 400 pounds in order to maximize my bone building ability through this osteogenic process. You can see why that's so difficult to do, because there's no way, maybe 385, no, I'm just kidding, but there's no way that I'm even coming close to doing that, and most people aren't. So that's why it's challenging. So then when you look at walking, which is basically 1 time your body weight, it's not really enough to build bone density. Now, we love walking. Everyone should be on a walking program because there's a whole host of other benefits that you're going to get from walking. And we talk about this ad nauseum here at Level 50, but ideally everyone's walking 7 days a week and getting at least 7,500 steps. So at least a 30-minute walk every day. I know we've been having some challenging weather lately, trying to stay positive, so it makes it hard to get out there and walk. But in general, we need to be creative and hit the 7,500 steps a day, 30 minutes a day if possible. But walking alone is not enough. So what do we need to do? If you look at the literature, ideally we have 2 things. We want to try to strength train, so that way you are doing body weight squats, lunges, maybe you're in a gym. If you're doing Pilates, you've got the reformer, but you need to add some resistance to that so that you are working hard. When you use muscles and contract muscles, that in turn exerts a force on the bone as well, which helps to stimulate bone growth. So the best of both worlds comes when you have impact and additional stress from the muscular contraction. So lifting weights is a must. Everyone should be on a weight training program at least twice a week, whether you have osteoporosis or not, male or female. And the reason is that as we get older, we get more frail and we get more fragile. And the stronger we are, then the more we are likely able to age better. And so we really need to keep that strength going. If you're not strength training at least twice a week, then you're not even keeping what you have, and we're going to slowly, just like we lose bone mass, we lose muscle mass as well too, which is called sarcopenia. So particularly if you have osteoporosis or bone density issues, you have to make sure that you strength train at least twice a week. If you're not quite sure what to do, check out the 5 pillars of fitness. If you're still not sure, hit us up for a question, anything like that. We'll be happy to get in touch with you. If you want additional one-on-one, you can always set up a tele session or a coaching call like this, and we can figure something out to get you on the right track. The next thing is that you want to make sure that you are working on your balance. Because let me give you an idea. Let me give you an example. We've talked about impact sports, and so if you can get yourself involved in pickleball, tennis, basketball, anything where it's multi-directional impact sports, that has been shown to really be beneficial for bone density. But then the next question I get is, I've got an arthritic shoulder, I've got an arthritic knee, I've had surgery on my ankle. There's no way that I'm playing tennis or even pickleball, because if I did, I would be in so much pain. So, and I understand that. But walking alone is not enough. So what can we do? We can try a weighted vest. And once again, if you have questions on that, you can let me know. But a weighted vest is a great place to start to add 6, 8, 10 pounds to your body, so that when you do go out for your walk, you're adding more resistance, you're more weight into your body. Then when you're done, you unzip it and you hang it up and you take away the extra 10 pounds of weight. But it is another way to try to build some bone density and to improve that. Taking the stairs is another great way, because taking stairs can be almost 1.5, 2 times your body weight. So if you have an opportunity, if you live on the 5th floor, like I told my mom back in India, Mom, take the stairs up to the 1st or 2nd floor and then take the elevator the rest of the way. So if you have an opportunity to take some stairs, make yourself do that. You're not going to ruin the cartilage of your knees or anything like that by doing some steps. Now, if you did steps for an hour, yeah, you'll probably make your knee pretty sore. But anything less than that, I want you to be thinking about, I'm building bone mass density. I'm building bone mass density. A simple balance exercise that I have people do is standing on one leg. So 3 1-minute sessions on each leg. Now, what you want to do is you'll either do it on a kitchen counter or somewhere in a corner where obviously you are safe, but you're working on balancing on one leg. And what you're doing is not only working on balance, strength, proprioception, but what you're also doing is you're loading the bone with your body weight for a solid minute at a time. Time under tension is important. When I'm walking, every time I step, I absorb some weight, but then I'm quickly coming off of it. So I'm not really weight bearing on one leg for very long, maybe a fraction of a second. So there's not enough of a load in order to stimulate those osteocytes. But if I'm balancing on one leg for 60 seconds and repeating that 3 times with a little 10-second interval, now my time under tension is a lot greater. So even though it's just my body weight, now all of a sudden there's more likelihood of me stimulating those osteocytes to say, Ed's doing a little bit more balance activity. I don't know, maybe we should make the bone a little bit stronger in here just to help support whatever it is he's doing. Once you can do that, and you feel like you're getting a little bit stronger with that, the other thing that you can do then is imagine holding on to some weight. And so I'll have people that put their weight vest on while they're doing that exercise, because it's important that you want to try to load as much weight as you can safely. For example, I have an old knee injury from high school. So if I do a lot of weight bearing, squats, lunges, then my knee gets pretty sore for 3 days, 4 days afterwards, swells up a little bit. So it doesn't make a lot of sense for me to try to build strength that way, but then irritate my knee. So I have to be creative, just like you guys, right? So I'll do lighter body weight stuff. Every time there's stairs, at work there's stairs, so I take an opportunity to do the stairs. So whenever we have an opportunity to load it the best we can, it's really important to do that. And plus with balance, then we're less likely to fall in the first place. I'm going to be making another video that talks about a cocktail, if you will, of supplements that has been shown to be just as effective as taking pharmacological medicine in terms of osteoporosis and building bone density without all the side effects. It was called the COMB study, C-O-M-B, and it's an acronym for combination of micronutrients on bone. And it's a great study, and it talks about how it's not just vitamin D and calcium, but it's strontium, vitamin K, and some of these other supplements, when taken together, kind of almost like they fertilize the soil, if you will, to let the bone, bone mass increase and bone density improve. So I'll make a video on that. I'll post it on the site as well too. So that if you are at that crossroads, maybe talk to your doctor. Say, look, doc, I came across this COMB study. Can I try these supplements first before I go straight to that Fosamax and then maybe see what happens? We'll be talking about bone density again in the future because it is a huge umbrella that covers a lot of things. Might seem a little bit overwhelming, but the great thing about lifestyle medicine, which is basically what we're all about at Live Well 50, is what we try to do is treat these chronic conditions with lifestyle choices. So we talked about how exercise and walking is important for bone density, but guess what? Whatever is good for our bone is good for our brain, which is good for our heart, which is good for our muscles, which is good for our digestion. So the nice thing is that if you basically lead an active lifestyle, and it's focused exercises along the way, which we can kind of help fill in the gaps a little bit, there's really a whole lot of carryover, all right? So I apologize again that you didn't get the live with my lovely Elizabeth here, but we had some Zoom issues that we'll take care of for the next one. If you have any questions, please let us know, and expect a whole lot more about osteoporosis and bone health to keep coming at you continually, because it really is a big issue and that we really have to get on top of it. All right, guys, thank you very much for watching. Any questions, please let me know, okay? Take care.